As a clinician, we might be interacting with our adolescent patients, even young adult patients in a kind of like a well child check or an annual physical or even just in a routine visit. How can we ask this and really ask it in a way that's maybe not going to shut somebody down or be judgmental, but how can we really talk about it in an enlightened and educated way with them?
Right. I think so much of that will depend, I think, first and foremost, obviously, on the age of the patient that you're working with. But with broad brushstrokes, I think showing some degree of just curiosity and openness to someone's response, a little of that can go a long way. I don't think the goal here is to tell young people never use social media again. I think it's a completely unrealistic goal and it's just never going to happen. It's part of the landscape of how we live now. However, I think as a clinician, part of what you can do is demonstrate some curiosity and also provide an opportunity to give some education about social media. Right? So you might ask, listen, I know that social media is something that's really common. Everyone is using it. Heck, I even use it, right? However, we also know that long-term use or repeated use of social media is something that can be associated with some negative health outcomes. So there might be reason to believe that it can affect your mood, it can affect your anxiety levels, or even your eating habits. I wonder if the type of content that you see on your social media accounts has ever made you feel badly, made you feel depressed or anxious, or made you worried about your body, right? Asking those kinds of questions gives an opportunity for someone to answer in a way that they feel comfortable and also demonstrates that you as a clinician understand this issue.
If we have a parent in the room with that kid, or if we're talking to parents separately, even without their children around, is there anything that we can say to them to help raise awareness about this issue?
Absolutely. I think in the same way that you would provide education to the adolescent or young adult personally, you can do the same thing with parents. I think many parents feel exactly like you do. They're aware of this information. They're aware of some of the negative effects of social media, but they're really challenged in terms of what to do. So I think providing them with some resources that, we even have here in these resources from today's podcast, and also just making sure that they're aware that as parents, they do have the ability to help control some of that with the limited social media controls that are out there. So to be clear, there's no way to sort of regulate the content that your children are exposed to in this moment, but there are different parental controls, ways to monitor how long your children have been on these platforms to try and maybe limit some of their exposure.